Hello students, this is Dr. Faizan Mirza. We are discussing lung volumes and capacities, the techniques to study lung volumes and capacities. Previously we have covered how the spirometry is used. We have just discussed one technique. Now we are about to start with the second technique, which is used for calculating residual volume or even other capacities and volumes. So the technique that we are about to discuss here is nitrogen washout method. Now what is nitrogen washout method? In nitrogen washout method, we need to keep in mind that normal air is 80% of nitrogen. If the total quantity of nitrogen in the air in your lungs is measured, this can represent the amount of air present in lungs. How is this procedure done? The subject breathes normally, and at the end of normal expiration, the subject then inspire pure oxygen through a valve, and after inspiring, the person exhale the air in a bag called as the Douglas bag. So inspired air is pure oxygen through a valve, and the exhaled air is sent into the Douglas bag. This is repeated 6 to 7 times. So all the nitrogen in the lungs which was present initially is displaced by pure oxygen, and all the exhaled air is collected in the Douglas bag. Functional residual capacity is what we need to calculate here using nitrogen washout method. How functional residual capacity is calculated? You use the formula of C1 into V upon C2, where V is the volume of air collected, C1 is the concentration of nitrogen in the collected air in the Douglas bag, and C2 is the concentration of nitrogen in air generally, which is 80%. Apart from measuring functional residual capacity, as I mentioned, we can measure residual volume as well. To measure residual volume from nitrogen washout method, the subject breathes pure oxygen, which is this step, but upon forceful expiration. So for functional residual capacity, the whole procedure is done after normal expiration. For residual volume, the whole procedure is carried out using forceful expiration, and this is how the person breathes through the valve. This is the oxygen cylinder and the valve through which the oxygen will go into the lungs, and the air will be displaced. This nitrogen will be collected in the Douglas bag, and the concentration of nitrogen in the Douglas bag can be calculated and computed in the formula. The second technique here is helium dilution series. In helium dilution series, the respirometer or the spirometer is filled with a known helium volume. How this procedure is carried out? After normal expiration, the subject breathes helium from the spirometer. The helium will go in lungs of that subject and will mix with the air which was already present in the lungs. It would displace that air. After some time, this is repeated again and again, an equilibrium concentration will be reached where helium will be in the lungs be same as it's outside in the spirometer. The equilibrium concentration of helium in the respirometer at this point will be equal to the helium concentration in lungs. This is called equilibrium helium. This equilibrium helium needs to be achieved, and this may take multiple breaths to be achieved. Once equilibrium helium is achieved, the concentration of helium in respirometer is measured, which in turn tells the amount of helium in the lungs. The formula for calculating FRC, the functional residual capacity, here is C1 by V1 divided by C2, subtracting V1 from it, where C1 is the initial concentration of helium that we took from the respirometer, C2 is the final concentration of helium again in the respirometer, and V is the initial volume of helium present that we filled here in the known quantity. This already I have discussed with you, that spirometer is used for measuring vital capacity and all. We already have covered that. Again, in this way as well, we can also calculate residual volume in the very same way as we discussed here, that how residual volume can be calculated from this helium dilution series, in the same way as we discussed in the nitrogen washout method, that to measure residual volume, the person will breathe this helium. The person will breathe this helium from this respirometer using forceful expiration. Initially, the person was using normal expiration, and this was followed by breathing in that helium which was present in the respirometer. Platismography. This is another technique which is used in respiratory physiology. It is basically used in physiology other than respiratory physiology as well. It measures the change in volume in an organ inside the or in the body. So since we are discussing respiratory physiology, we'll be discussing pulmonary platismography. What is pulmonary platismography? In this technique, FRC or residual capacity or TLC, we know that in diseased lungs they get reduced. So the airway resistance can be measured and can be differentiated from an obstructive disease. A restrictive disease and an obstructive disease can be differentiated using a platismography technique. What happens in platismography? There's an airtight box with a pressure sensor or a pressure transducer in its walls. There's a mouthpiece which is connected to an electronic shutter, and this electronic shutter in turn measures the airflow and the alveolar pressure at the same time. The patient sits inside that airtight box and breathes through the mouthpiece provided. At the end of normal expiration, the mouthpiece is closed and the patient is asked to make an effort, an inspiratory effort, to keep on respiring through the closed mouthpiece. As the patient tries to breathe in and out through the closed mouthpiece, air cannot be exchanged any further. This leads to panting of the subject. The total quantity of air in the box stays constant because the person is sitting in an airtight box, and panting occurs because the subject is simply compressing and depressing the air which is already present in his or her lungs. For example, these are the air molecules. So the person is either compressing them or stretching them further. So this is the compression and rarefaction that we discuss in the stationary waves. So you can see that the person is just compressing or depressing these the same air in his or her lungs. As the lungs expand because of this, the volume increases inside the pressure and the pressure decreases. This volume increases the thoracic volume, which increases, and the increase in the thoracic volume increases the pressure in the box. This is the airtight box with the pressure transducers, which I'm showing with the red ink here, and the subject will sit inside this airtight box, and as this is the airtight box here, where the person will, this is the monitoring devices which will be placed here with all the transducers attached. This is the mouthpiece which we'll close once the subject is inhaling. We'll give the subject a stool to sit on, and the subject is then asked to just inhale and exhale, and then we shut this mouthpiece so the person makes an inspiratory effort there. So pressure changes in the mouth will be same as in the alveoli. So we'll apply Boyle's law here. P1 is equals to P2, P1 V1 is equals to P2 V2. We'll use the Boyle's law. P1 V1, we'll just rearrange this for V2. So this V2 is actually V1 plus delta V. So we just rearrange the formula. P1 V1 is equals to P2 V1 plus P2 delta V. We have just opened up this bracket using P2. So taking out, bringing this P2 and V1 on the other side of the equation, we have P1 V1 minus P2 V1 is equals to P2 delta V. V1 can be taken as common here, so it means that in the parenthesis of bracket we'll have P1 minus P2, and we'll have P2 and delta V on the other side of the equation. V1 will be equal to P2 delta V upon P1 minus P2. This is the equation which is solved for platismography, and using this we can calculate the volume changes which are represented by the subject. And as already mentioned, platismography, this is just a technique which is used to measure change in volume in an organ or the body. And pulmonary platismography is using this whole technique to see how the changes occur in the lungs region. As I already discussed, the restrictive disease and the obstructive disease can be differentiated on the basis of the outcome of this platismography test. That's it. Thank you so much.